Hi, welcome to Evidence-Based Practice Nurse Residency module. My name is Dana Bush. I am the Clinical Education Specialist with the specialty of Level of Care for Emergency Department. First of all, you want to know what is going on with the Evidence-Based Practice project. So, here's the timeline for your projects. For the January cohort, you're going to have approximately 1 month from this recording to the time of this presentation to turn in your PICO question. And then you'll get dates of when your actual final presentation is due from either Brenda or from your CES in your small groups. For people in the June cohort, you have approximately 5 months from now. So before your PICO is actually due. You can do it earlier. And then you'll have approximately 1 month before your final presentation is due, before your graduation. So when you're out there practicing nursing at the bedside, and you're always thinking, why do we do what we do? Wonder why we do it this way. That's a great opportunity for you to say, hey, this is something great for an evidence-based practice project in nurse residency.
I'm Caryl. I'm the nursing director for nursing research, and we have a new model here at St. Luke's, and that's an evidence-based practice model from Johns Hopkins. So when you do have the clinical question that you're kind of wondering about, you're going to use this model to kind of finalize and land on what your real question is going to be. So that first step is, you want to click on that, or I'll click. All right, it's just, what is the problem? You don't actually have to do a statement, but it's noted as a problem statement. You then do your EBB question, which is a PICO question, which we'll talk about in just a minute. But part of that is determining the need for the evidence-based practice project. Again, this is clinically based, so you want to make sure that you're addressing a need in your area specifically. So you're going to ask a lot of questions, right? One of them is, does this fit with organizational priorities? Is what you're thinking that you want to work on an evidence-based practice problem, does it fit with what the organization wants to do? Or what the organization priorities and goals are for that organization. There's a lot of other questions to consider as well here. One of them being, does it fit with your unit, right? It's not just about the St. Luke's health system, but it's also about your unit. I think one of the biggest things that you can do is right here, is determine whether there's already a standard out there or a guideline that you already need to go by concerning this one topic or this question that you're going to be doing. So you want to do just a quick search. It's just on Google, right? Just do a Google search just to see whatever's out there. Maybe a guideline pops up, and if there's already something there, then you don't do an evidence-based practice project per se, because there's already a guideline. If there is a guideline and the answer is yes, then again you're going to ask yourself, does this guideline fit with our unit? Is it feasible for our unit to do? And if it is, then you go ahead and make your change. But if there's nothing out there, which they're probably in it, is not, then you want to begin your evidence-based practice project. And to begin, you have to go to the body of literature. You have to see what is out there in evidence and really critique and appraise that evidence to do your whole project, which is then you're going to complete it.
Let's hear from previous nurse residents about their project.
We initially started with urinary retention and using peppermint oil to not prevent, but help urinary retention. And
we actually found that there wasn't enough research on that topic, so we had to broaden our horizons and do just like essential oils in general. But there is potential for us to complete research in the health system with peppermint oil and other essential oils.
So my NRP project was the post-op bilious prevention. It is now an order set. Basically, it is an order set for patients that have had certain types of surgeries to chew gum after the procedure when they're back up on the floor, and it helps prevent post-op biliouses by helping them pass gas faster, have a quicker bowel movement, reduces their stay in the hospital, and improves patient satisfaction. As a new grad working on the project, we had to go through the whole process of getting it approved since it was going to be an order set. So we started with the physicians and then went to the evidence-based team. We did all the research for it, and it was eventually added into an order set for several different surgeries. So it's something that I worked on as a new grad 4 years ago, and I still am working on it and see the changes throughout the system. And it's awesome to see the order set on patients that I take care of now.
Our NRP project is an emergency department aggression rating tool. We call it the EDART.
Yes.
It is a tool that we help assess and score our agitated, combative, maybe high, maybe drunk, emergency department patient. That we found a tool was for an ICU that was being modified, or a tool for an ambulance service was being modified. Not only did we find that there wasn't a tool for a specific population, there wasn't one in this hospital or another hospital or any hospital in America. So we're hoping to get not only this part of St. Luke's, like a tool to be used in St. Luke's, but hopefully around
Use it
emergency
everywhere.
departments everywhere.
The goal with it, we provided interventions for nurses to quickly recognize those symptoms or those behaviors and intervene to prevent escalating behaviors and reduce people going in restraints and increase safety for patients and nurses and all of the staff.
Yep.
Yes. How many people did you say there had been?
There'd been like 1,000, I don't know, it was like 1,300 activations
Of either 2 or higher?
of 2 or higher.
Okay.
Security had to come wand 57 of them,
Okay.
and only one of those people were in restraints.
That's awesome.
Yeah.
I never dreamed and didn't realize that so many different departments were involved in changing something that just involved one department. Like we're in the emergency department, and what we're wanting to do is for the emergency department, but we had to involve security and legal and regulation and research, and I would have never dreamed that all of that would be involved in process of change.
Wasn't just nurses.
No. We work as a team.
Yeah,
All
'cause I'm
like
like,
in society.
That's refreshing you. Yeah.
Exhale.
Okay.
Okay.
Yes.
Pick a project that you can take further. Don't be an autopilot.
I would say pick a project that you really care about, something that you're going to be vested in, and be prepared to be patient.
I would say that you need to find something that you're passionate about, and that's going to keep your interest, not just during the process of doing the project, but even afterwards if you want to carry it out and get it put into practice.
To get together with a group and just come up with questions and answers, and because it doesn't take only one person to come up with what's best. It is wherein a lot of nurses come together and give their input.
My biggest advice would be to start early. Don't procrastinate. Talk with your peers, even if it's just kind of like throwing out ideas you don't know might have enough information. And that's the benefit of starting early, because you can, research a little bit to see the amount of information that's out there. If you need to change your idea, then you've got enough time to do so.
I would probably say don't procrastinate. It's easy to just like make a list of the things you need to do and divide it up with your group and make sure everyone is on the same page about it. And it doesn't take too long to do that. So
I would find some research, make sure that you have enough research to support what you're talking about.
Okay, when you ask your fellow workers and say, why do we do what we do this way? Why do we do it this way? They might say, because we've always done it this way. And that's not an answer for you to accept, okay? So you really want to go to literature and really find out the why. We do have some topics that you have to avoid because they've been done over and over in the nurse residency. So one of them is anything with staffing, including the shift lengths or the hours, anything that has to do with staffing, we're going to avoid those for the nurse residency program. Also, telemetry placement leads for the lead placement. We're going to avoid those as well. ED border patients. We've seen lots of literature on ED border patients. Skin to skin contact. This is like in OB or the NICU. We're going to avoid that. We've done a lot of nurse residency projects on that one. Bathing for neonates, same thing. Anything related to eyes and nose, we're not going to have that. This is on our off limits for nurse residency program. Anything related to animals, so like therapy animals, things like that, we're not going to have as an evidence-based project. Probiotics and C. diff, we've seen a lot of projects on that. Mock codes, it's off limits. Alarm fatigue, we all know alarm fatigue exists. There's lots of research out there on that. We've seen a lot. And heart failure, that's off limits as well. So you might talk to your CES in your small groups and ask them if there's any other items that are off list for your department or your group, okay? Once you do your evidence-based project, then you're going to do a PowerPoint, which we will send you a template for the PowerPoint, and you're going to record your PowerPoint and upload it to YouTube, and then send it to Brenda Potter and your clinical education specialist. But it has to be YouTube. No other recording format is going to be accepted. And you're going to need to write a PICO question as part of your process. So even though you may have examples or may have had experience writing PICOs, we still want to do some PICOs with you. So PICOs, P stands for population or people or the problem. I is your intervention, and C is the comparison. So your intervention is your new thing compared to what you already do in practice. And then what's the outcome? We also want to add a little more to it. We want to add time. So by when? Maybe when that outcome is, or by time. When would we expect to see something different, something change? So we're going to let you do some practice PICO questions in your small groups, and then we'll come back and we'll talk about each of the possibilities that could happen.